My name is Anoop Shah. I'm an interventional cardiologist here at Virginia Cardiovascular Specialists. My role specifically is doing cardiac, coronary heart stents and peripheral vascular interventions. I grew up in Hampton Roads in Yorktown, and I was in a governor's school, and we did these externships in high school where they partner you with a professional in a certain field, and I got partnered with a cardiologist. And so like half day a week, every week when I was a high school student, I would go put on my shirt and dress up and go over and spend a day with a cardiologist. That got me on the track of medical school as being my interest. I didn't know what I was gonna do, like what kind of physician I was gonna be at that point. But looking back on it, it kind of all started with that externship. Then I went to UVA for undergrad. I loved it at UVA. I was fortunate enough to stay there for medical school, so I spent 8 years there. After I had to apply for residency, I wanted to go kind of to a bigger city to kind of experience that because I hadn't. So I went to University of Pennsylvania in Philadelphia, had a great time there. We didn't love the Northeast cold. The winters were kind of brutal, and so we tried to figure out, well, where can we go for fellowship? And we found the Texas Medical Center down in Houston, and I trained at the Texas Heart Institute. And in that span of time for my training, I was able to do what other people do other places. Takes 5 years. Down there, they really, you're hands-on from day one. And so you do coronary, peripheral, structural, all these aspects of cardiovascular care that are all exciting as a trainee. You get to do that in 4 years there, and so that was great. And then, fast forward, marriage, 2 kids later, we wanted to come back home. So Richmond was a natural location to be close to family, come back home, and close to Charlottesville and UVA. So when I met the guys to interview to say, hey, I'm interested in moving to Richmond, you're a large cardiovascular group in Richmond, and not only was everybody I met great, but they explained the value of having such a big group. It's that collaboration, that work ethic that really sets VCS apart from everyone else, because they're working together. And then if I have a question about an image, an echocardiogram, and I know I have a guy that specializes in echo, I can just call him up and say, hey, I have something I want you to look at. Or if I have somebody with bad heart valve disease, and we have 2 great structural heart guys that just came from top tier training programs, that I could just be like, hey, I have this valve problem, I need your help with this, And we work together all the time, so everyone's available, and it makes it so you can provide the best care for your patient. I think as long as we're communicating amongst the providers, amongst our staff, our multidisciplinary teams, and then we're also relaying that communication, relaying that information, communicating to the patients, then it's going to make for a great patient experience, and not only their experience, but the care they receive is going to be better.